Well, hello, everyone. I'm Congressman Bill Foster. I'm a scientist and businessman, and I represent the 11th Congressional District of Illinois in the United States House of Representatives. Thank you all for joining us for today's expert panel discussion on COVID-19 variants and vaccinations. I'm honored to be joined with the following team of local experts. First, Dr. Dion Antonopoulos, the Argonne National Lab Director of Biosciences. Lynnea Windell, RN, MSN, FAAN, who's the VNA Healthcare President and CEO, and Dr. Atul Gupta of Silver Cross Hospital. Today's conversation is incredibly important and could not be more timely. We are currently dealing with the rise of the highly contagious and dangerous COVID-19 Delta variant, with the school year upon us and children returning to the classroom. The world and our country have endured over a year and a half of sacrifice and tragedy because of this virus, and we want this to be over and behind us. But to be clear, we have the tools to defeat COVID-19, safe, effective, and widely available vaccines. And thankfully, over 62% of the population above 18 is fully vaccinated, and over 72% of the population over 18 has received at least their first dose of a vaccine. Here in Illinois, we've led the way in demonstrating our commitment to the health and safety of ourselves, our neighbors, and our loved ones by rolling up our sleeves and getting the shot. Over 77% of Illinois residents above 18 have gotten at least one dose of a COVID-19 vaccine so far. So for those of you who've gotten vaccinated, thank you. We all appreciate it. And for those of you who might not yet have gotten vaccinated and are still thinking about it, well, we're looking forward to answering your questions today. And our health experts are ready to provide some additional information that hopefully will encourage you to head to your nearest pharmacy, healthcare provider, or walk-up clinic and join the great majority of your neighbors and fellow citizens in protecting yourself and your loved ones from COVID-19 and the Delta variant. There are some additional precautions for those of you who are already vaccinated that will be discussed in today's conversation. So if you are fully vaccinated, there will still be relevant information for you as well. This week, President Biden announced that Americans who are already vaccinated against the coronavirus will be eligible and are highly encouraged to get booster shots. It's normal for vaccine effectiveness to wane over time, and the science suggests that 8 months after your second vaccine dose is a good time to add a booster shot. These booster shots will help bolster your antibodies and keep your protection from COVID at high levels as we enter the winter months. Booster shots will begin on September 20th and are only suggested for people who've gotten the Pfizer or Moderna vaccines at this point, although that's likely to change. Scientists are studying the data to see if people who got the J&J vaccine should also get the boosters. And people will become eligible for booster shots 8 months after having received their second dose of the coronavirus vaccine, meaning that older and more vulnerable people who were the first to receive the vaccinations last winter and spring will also be the first to receive their booster shots come this fall. And I'm looking forward to discussing all of the COVID-19 and vaccine-related topics this evening. Again, thank you for joining us, and let's get this conversation started.
All right. Thanks, Congressman Foster, and good evening, everyone. My name is Dion Antonopoulos, and I'm the Director of the Biological Sciences Division at Argonne National Laboratory. I'm going to start things off by telling you a little bit about the ongoing work at Argonne on COVID, and then move on to giving you a general overview of the Delta variant and how we counter the virus with vaccines. At Argonne, we've used a number of cutting-edge tools and leveraged unique capabilities we have here in order to study the SARS-CoV-2 virus that causes COVID-19. These include tools for looking at the virus itself in different ways. One way is generating high-resolution images of the virus and its individual parts using bright light X-rays that are generated by the advanced photon source here. This allows us to actually look at the virus at a very fine scale and understand how drugs may be used to target it and inactivate it. We're also leveraging artificial intelligence and supercomputing resources at Argonne to computationally screen tens of millions of chemical compounds in order to down select which ones should be tested in the lab that can be used for therapies. these same computing resources are also being used to analyze and screen the genomes of variants of the virus in order to track them as they emerge. Which brings me to talking about the Delta variant. So to begin with, what is a variant anyways? When compared to the original SARS-CoV-2 virus that emerged in late 2019, a variant of the virus is one that has a single or even more mutations in its genome. The genome of the virus contains on the order of just under 30,000 bases or letters that serve as the blueprint for the virus. As the virus replicates, makes copies of itself in a human host, it sometimes makes mistakes. In other words, the letters get switched up. These are mutations. And at 30,000 letters long, that's an opportunity for many, many misspellings. So the virus makes mistakes as it moves from person to person. It makes additional mistakes. And sometimes these mistakes don't matter. We all misspell words from time to time, but you can still understand what I'm trying to say when I've sent you a text that hasn't been spell checked. Likewise, the virus goes about its business being a bad speller, but hurting people just the same. Other times, these mistakes can lead to the words meaning something else, or sometimes just making them illegible altogether. This can cause multiple problems. One of them affects testing. COVID-19 tests are predicated on targeting a specific word or set of words in the virus. When the tests suddenly stop yielding positive results across many, many batches, either it means the virus is just not as prevalent in the population, which is great, or it can mean that the target has changed. And over the past year and a half, this is exactly what has pointed to new variants emerging. The good news is that we can adjust and fine-tune the diagnostic tests. The more worrisome part is when these changes affect how the virus operates. Sometimes it leads to the virus being better at attaching and entering human cells, or it leads to the virus making even more copies of itself in a host. So in the case of the Delta variant, what we're seeing is that it's nearly twice as transmissible as the original SARS-CoV-2 strain. It replicates faster, and it generates over 1,200 times higher viral loads than the original strain. So as a result, from the time that it emerged in India in October of last year, it has now spread to 130 countries. In the US alone, it went from being under 10% of all SARS-CoV-2 genome sequences just at the end of June to over 80% by the end of July. That's really, really fast. The additional worry with the Delta variant is that the indicators point to unvaccinated persons experiencing more severe illnesses than with previous variants. So this is why vaccines are such a vital tool to not only slowing down the spread of the virus, but for preventing the emergence of additional variants that could be even more problematic. The more people that are vaccinated, the lower chance the virus has of replicating in a population overall. The vaccine ensures that your immune system recognizes the virus and dismantles it. It's kind of like your immune system becomes a really cranky bouncer at a bar. And even if a variant shows up, kind of like the virus showing up with a fake mustache, your primed immune system can still see through the disguise, so it kind of got distracted at first. So now imagine more and more people having gotten the vaccine. It's like more and more people having that cranky bouncer. The virus has run out of places to hang out. It's run out of places to replicate. It's run out of places to keep making bad spelling mistakes and create additional variants. So on that note, I'll turn it over to Lynnea Windell to talk a little bit more about the importance of vaccines in our communities.
Thank you. My name is Lynnea Windell. I'm the president and CEO of VNA Healthcare. We're the largest community health center serving the Chicago suburbs. We have 16 sites across the area serving 75,000 people, and we provide care regardless of whether people have insurance or the ability to pay for services. So we're really committed to ensuring that people have access, which I think is so important as we think about vaccines and testing and services during this time. VNA staff have provided about 38,000 tests so far since the pandemic began, and so far have provided 58,000 doses of vaccine. We're doing that at our clinics by appointment or walk-in, and testing also is available by appointment at our locations. I also wanted to mention that community health workers are another way that we're helping people during this pandemic. So people that are impacted by COVID in some way can have assistance from a community health worker who can help arrange medical care, arrange testing, arrange the immunizations, and provide practical help like transportation, which we know for many people can be a barrier to getting immunization. the community health workers are there as available resource to provide information for people as they have questions about vaccination, about COVID in general, and are available in our clinics and in community locations by phone, and really there again to serve as a resource. If a family or individual is impacted by COVID, our staff providing these services can help connect people with other community resources too during that time. So that's just a little bit of an overview of services and ways that we can help during this time, and look forward to our discussion some more tonight about vaccination and the importance of vaccination as we work through this pandemic. Now I'll turn it over to Dr. Gupta.
Whoops, we seem to be having an audio problem. Are you muted in some way, Dr. Gupta? Yes, I think I hear you now.
How's that?
Great.
Okay, sorry about that. Welcome everyone. I'm Dr. Atul Gupta. I'm an infectious disease doctor with Southwest Infectious Disease Associates. We're in Joliet and New Lenox. I've been practicing in the area for about 17 years now. My partners and I are the infectious disease doctors for both St. Joseph Hospital in Joliet and Silver Cross Hospital in New Lenox. And we have been at the forefront of not just patient management with COVID throughout this pandemic, but also helping both hospitals develop policies regarding COVID, focusing on isolation, testing, treatment protocols, resource management, including, of course, at the beginning of the pandemic when we did have some shortages of PPE to keep our staff safe and to prevent the transmission of the virus within the hospital. I am the medical director of infection prevention for Silver Cross Hospital. And one of the main focuses, especially at the beginning of the pandemic, was making sure that we could keep our staff from becoming exposed and or infected with the virus, both to keep them safe, but also to keep them working and preventing staff shortages. Because of course, the hospitals have been intermittently extremely busy, if not overwhelmed with patients. And it was really critical for us to be able to maintain our staffing levels with healthy staff to take care of all the patients we were seeing. There have been lots of up and downs over the last 18 months, but we've managed to maintain up. I would like to point out, I know there's a lot of frustration in the public with changing guidelines. We, at the beginning of the pandemic, we didn't know anything, really. We knew about coronaviruses in general, but this was really a whole new animal. And the speed it was spreading in the country, the seemingly marked ease of transmission, people spreading the disease before they were even being symptomatic, it all threw us for a loop. And so we were changing in our hospital, we were changing our policies sometimes multiple times a week to keep up with both conditions on the ground and also just emerging science and new information. And I think, we can see that on a national scale as we learn more and more. And as the conditions on the ground change, public health recommendations have to change. And if they didn't change, then we wouldn't be doing our jobs. So I understand it's frustrating with masking and vaccines and social distancing. But as we learn more and more, we're actually getting better at trying to keep this under control. So I think it's important for everyone to be patient with that, because all of these measures are really our best way out of this at the end of the day.
All right, well, thank you. And so I guess at this point we can start answering some of the questions that we have here. Let's see, the first one is a general one. What is the best way to talk to a person who's hesitant about getting the vaccine?
I'd like to just say kind of at the beginning of this, when we think about talking with people about getting vaccinated, that maybe kind of our first part of this is just to put aside our personal feelings and our opinions, and really approach the conversation with that sort of put to the side, so we're really listening to what is kind of the root of concern that the individual has. And as we kind of spend time listening and kind of hearing more about what's at the basis of the concern, then we can ask the person. And I think it's really important to ask if they would like more information, would like some information that perhaps you yourself found helpful in your own decision. So I'd offer that as a start.
Dr. Gupta, what's your experience in that?
Well, I think that's an excellent point. Finding out what each individual's everyone has a different reason for not wanting the vaccine. I personally, I don't begrudge anybody who's hesitant about getting the vaccine for two main reasons. One, understanding vaccines is complicated. It's not something that is easy for someone who doesn't have a lot of experience in infectious disease, immunology, public health, virology, to really be able to get their heads around. And at the same time, there's so much misinformation and disinformation out there, and it's so sophisticated, it looks very convincing. And so for a member of the public to try to wade through all that on their own is understandably very difficult. The only thing I would say is, I think it's important to recognize that the people that are recommending the vaccine are, by and large, a vast majority of scientists, doctors, more than 90% of physicians are vaccinated, public health officials, and the people who generally are recommending against the vaccine or who are raising fears about it are not those people. They're not the experts in these fields. They're, unfortunately, politicians, talk radio hosts. There are people who may have alternate reasons for recommending against the vaccine. But I think, just like with anything else, when I talk to my colleagues at the hospital, if I'm talking to a cardiologist, I don't pretend to know more about cardiology than them. If they recommend something for a patient, I go along with it. So I think this is one of those instances where it really does make sense to figure out who's an expert and what are they recommending.
Okay, no, I'm not going to toss that question to Dr. Antonopoulos, because both he and I are scientists. And if you're in some scientific conference, the point is to try to prove why I'm right and you're wrong. Okay,
but at the same time,
and that's different. That's a different game. And but maybe you're better at it than the average scientist. So give it a shot.
What I was just going to actually state, Congressman Foster, is that it's very funny, is because what ends up happening is that within sort of social circles, I end up becoming sort of the de facto expert that everybody points to, that they need to go talk to me type thing. And one point that I want to sort of highlight with what Dr. Gupta was just pointing out was the amount of information that's out there. And there is a lot. And the reason that there is so much information out there, despite the misinformation component, let's set that aside, is that this has emerged quickly. The response has been fast. And the amount of work that's been done, I've seen nothing like this that's mobilized the scientific community like something like this. And so as a result, there's a ton of information that comes out there. But to your point, Congressman Foster, as scientists, the issue is that it's taking this information in and it's recognizing that there's always new information coming in. So it's a matter of constructing a model of how we think about things and being able to take in that new information as it comes along. The point that I wanted to get at, though, more importantly, though, getting back to again of how do you talk to people that are hesitant, just comes down to people are hesitant because they're uncertain. There's something that they just want to be able to hang on to. And many times that has to do with personal experiences. And so what I found that really helps is at least listening to what their sort of immediate concerns are. What's that one piece of information that's sort of missing from them? And more importantly, encouraging them to talk to their primary physician as well. There's just too much in terms of people's own medical histories that nobody's going to know that better than their own personal physician. And so they need to talk to that person primarily.
Thank you. And I'd like to remind all of our viewers on YouTube to please submit questions if you're interested. Let's see, a question we have here is just how effective are the vaccines against the Delta variant? not only for keeping you from getting sick, but keeping you out of the hospital and keeping you from dying.
The challenge right now is that that information is just coming out. And so there are constant reports that are coming out week to week in terms of whether there is a waning in terms of the efficacy of some of the vaccines over time. Leading again to sort of the comments you were making earlier about advocating for booster shots as well. But there's also new information that comes out as well for individual vaccines that are faring better against this variant than they had against other variants previously. The main thing is that in a biological world, things are changing over time. And so as a result, it's a matter of taking in this information. Honestly, at this stage, it's almost week to week.
I would add to that, even as the data keeps coming in, we are certainly seeing a heavy bias towards vaccinated patients not being hospitalized. Certainly, we're learning more and more about the possibility of breakthrough vaccinated population. But as far as seeing those patients hospitalized and ending up in the ICU and the risk of death, there's no question that the vaccines are extremely effective at preventing those things. And that's really, historically, that's the main reason we vaccinate people. It's not necessarily to prevent every single infection out there, it's to prevent the damage that the infection does. And these vaccines are still very effective at that. I think that's an important point for people to understand, because there's a lot of talk in the media for infections, which is absolutely true. It is possible. But as far as getting very sick and dying, and I can say from personal experience treating patients these days coming in with the Delta variant, they're almost uniformly unvaccinated.
I see. Yeah, I remember seeing not long ago the statistic that more than 98% of those who did succumb to COVID-19 were people who are not vaccinated. And how hard this is for doctors, actually, because they have to treat patients knowing that their disease is completely unnecessary, and had they taken the vaccine, that they would not be in the ICU or worse. Another question we have here is, how did the Delta strain take over and become dominant so quickly?
I think part of it was just some of the numbers that I was citing in terms of the transmissibility, in terms of its ability to replicate faster, and just the fact that it's just generating higher viral loads. It just, from a virus's perspective, we are viral factories. And so as a result, the Delta variant has figured out how to just really churn out massive amounts of itself. And this is what really, these base mechanisms are what really driving sort of the spread through the population overall.
I would like to point out, in the infectious disease community, we think of the most contagious viruses as chickenpox and measles. We say if someone has measles, you can walk by them in a hallway and you'll get measles from them. And people my age and older will remember chickenpox parties. It's very easy. It's important to not get chickenpox as an adult because it has a lot of serious health consequences. So parents would send their children to friends' houses who had chickenpox, spend an hour with them, and then all the kids would get chickenpox and get it over with. And that's how contagious Delta variant is. It's so much more contagious than what we had before. And it's on the order of the most contagious viruses that we have.
Yeah. And if you're my age, you remember polio and having your parents lock you indoors in the summer and being so grateful when you finally got vaccinated. You could go out and play in the summertime with your friends because of the risk of polio, which was not small. The next question here is, when will the FDA fully approve the vaccines, and shouldn't I wait until then? Lynnea, you've probably heard that. What's your answer to that?
Yeah, it's important. It's important to get vaccinated now. We've been hearing about the contagiousness of the Delta variant, and so really time is important here. It's important to do it now. And at this point, millions and millions, many millions of people have been vaccinated, and this is There's lots of data out there about the effectiveness and the safety about the vaccines already. We're facing this threat, this threat that's going on right now with a very, very contagious variant.
Congressman, I think you might be muted again.
Thank you. And the next question we have here is, how much more infectious are you if you get the Delta variant, whether or not you've been vaccinated? Yeah. Oh, it's a complicated scientific question. So
I think Dr. Gupta and I are saying who's sort of unmuting themselves first. So I was just going to point out that with regards to even individuals that are vaccinated, they're still capable, if they do get infected, of carrying and transmitting the virus. The difference is, though, is that the infectious period, it seems that at least with those that have been vaccinated, is a much shorter time period as well. And so that window of them being able to transmit it to others is much reduced compared to those that are unvaccinated.
Okay.
I would like to make one more point with regards to that. It's certainly likely that vaccinated people, once they're infected, may be as contagious, although for a shorter period of time, than the unvaccinated. But an important point to remember is the rate of infection, if you're vaccinated, is so much lower. So you're much less likely to become infected in the first place and therefore become a risk to your friends and family, which is a big benefit to the vaccines.
Okay, so the vaccine is a win, whether or not, even if you end up getting these, what do you call them, breakthrough infections, you're still better off having been vaccinated than
Absolutely.
not, just
Absolutely.
because the milder symptoms you're likely to experience. So will vaccines, then here's the next question, will vaccines offer protection against future COVID-19 strains? Boy, that's a tough one. Okay.
Who's to say? And the reason I bring that up is that even earlier in the pandemic, one of the things to recognize is that with the newer technologies that are being used to generate these vaccines, there is more flexibility, greater opportunity to be able to pivot these vaccines in terms of the targets that they hit. And so there was a period even earlier in the pandemic where Moderna was already producing a variant vaccine that was really supposed to go after the South African variant at the time. But here we are a few months later, and that's not the one that's dominating. We have the Delta variant that's dominating now. And so it's one of these things that there's just this constant game that's being played in terms of how we're preparing and how the virus is just literally a moving target. The good news that I come back to again, though, is that we're in a position as the vaccines roll out further and further. Honestly, we're just gathering more and more data as more and more people get vaccinated. And so we're able to keep a better assessment in terms of the efficacy for these variants as they emerge.
Okay, and now here's a somewhat different question. Can regular people see the giant machines at Argonne Lab that they use to study the virus?
So we typically have an annual open to the public event, and unfortunately during the pandemic, obviously that's not been the case. But once things open back up again, we'd love to have folks come visit on campus and interact with scientists, and as you put it, sort of see the big machines we've got here, the big toys.
Yeah. Well, I worked at a similar lab out at Fermi National Lab for 25 years, and we really enjoyed having the school kids come by also. And so those of you who are teachers or no teachers or who have children, when this all gets behind us, go visit these wonderful laboratories, because, we sort of do really interesting things out of the public's eyes. And then when things like COVID come around, you see the real benefit of having things like the advanced photon source at Argonne that really help people, help scientists understand what the heck is going on with this virus. Here's another question. I'm not sure, you'll have to interpret it. What ramifications does continued vaccine hesitancy have for the country or the world in terms of dealing with a prolonged pandemic?
The main concern is as the pandemic keeps going on, And as we have, an ongoing population of unvaccinated Americans, they're serving, unfortunately, as a reservoir for the virus to keep spreading through the community. And not just that, but also mutating, as Dr. Antonopoulos was saying, as the virus keeps replicating, it can only mutate if it's infecting new people and making more copies of itself. So the higher percentage of population we have vaccinated, the less likely it is to continue in a pandemic form, and the less likely we are to see, these surges of new variants over and over again. I would say at this point, with the contagiousness of the Delta variant, reaching true herd immunity is going to require a very high percentage of vaccination, but certainly every little bit helps. And keeping the surge from being too much of a peak and overwhelming our hospitals and our healthcare systems is still very important. With the contagiousness of this variant, at this point, you're almost choosing between vaccination and getting COVID. That's how contagious it is. And so, anybody that has been hesitant about it, waiting for the right time to get the vaccine, now is the time, without a doubt. There's nothing else to wait for. This is mission critical at this point.
Okay, and the next question here is an interesting question. Are masks an effective measure against the Delta variant, even with its higher contagiousness?
Absolutely.
Yep. Still very
okay,
important.
So the answer is yes.
Important.
Yes, it's very important. Okay, nothing more to be said on that. Nothing more to be said there. That's really important. Yeah, well, because I guess you never know, even if you've been vaccinated, you never know if you're going to get a breakthrough case. And if you get a breakthrough case, you can have as much virus as if you'd gotten the normal disease.
Right, and you may not realize you're sick. Even it could be that you could be asymptomatic and spreading, so it's really important.
I do see a lot of people saying, well, I see doctors and studies saying that masks don't really offer that much protection. An N95 mask really does offer very good protection. That's what we use in the hospital to take care of COVID patients. But the main reason that we recommend in a public health setting for masking is actually to prevent the spread of the virus to other people if you're infected. It's a community effort to prevent spreading the virus to the vulnerable and the unvaccinated. I had enjoyed not wearing a mask at Target for a while, and now I'm right back to it because I know at any point I could have an unknown infection, and I don't want to put anyone else at risk of that.
Okay, the next question is, what fraction of people do we have to get vaccinated to finally crush the virus here?
So it's that magical number for what we're referring to for herd immunity, right? And I think earlier in the pandemic, it's always been a bit of a guesstimate. And as time goes on and as we see additional variants emerge, we're just seeing that percentage just go higher and higher. But at this stage, a lot of it is just, based on the information we have at hand to make those estimates.
While it's certainly hard to put a percentage on that overall, the thing we know is that the more people we get vaccinated, the more we're going to see infections decline. We're going to see fewer infections. So if we kind of keep our eye on that individually and collectively, it's a huge importance to the individual and as a society, of course, reducing it by even a little, every bit helps.
Yeah, I sort of view this in some ways sort of like the laws we have against drunk driving, because if you drive when you're drunk, most of the risk goes to you. But some of the risk goes to other people. And so as a result of that, we have laws against it. And the same thing, if you're going around unvaccinated and unmasked, you are a huge risk, to yourself and to other people. And I think that, we're not to the point where we're going to have a law against this, but I think the same moral calculus really applies here, that you should get vaccinated, not only for yourself, but for the entire population. And it's that part of it's an individual decision, but I think that that we should step back and think about why it is that we have the rules against, all kinds of unsanitary practices are not legal in this country because for very good reasons. Now, here's another question. I have kids under 12. What can I do right now to keep them safe?
Get you and your family members vaccinated. That's the biggest first step. The way that I put it is that I've got a son who's 3.5 years old. He can't get vaccinated right now. But myself, members of my family, we get vaccinated, and it just decreases the probability that he's going to get, exposed. He's in a quote unquote safer environment. But we go out, fortunately, he is happy to wear a mask. He can actually be a little bit of a mask policeman with other people sometimes. But, we're really fortunate in that, is that he doesn't have an issue with that. And so between himself wearing a mask when he's out in public, having family members sort of, close environment vaccinated, it's just a matter of probabilities of just dropping down those instances, those chances that he could get exposed.
Yeah, I'm really impressed actually at how good kids are about wearing masks when you ask them to. It sort of reminds me when I was a kid, all of a sudden seatbelts became the rule. And everyone who grew up not wearing seatbelts thought, oh, this is a terrible invasion of privacy. And all the kids who were strapped in their seatbelt said, yeah, this is normal, makes sense, I'll do it. And now they and everyone sort of feels strange when you get into a car without wearing the seatbelts. And so I hope we get to that point with masks. Even under more normal circumstances, when you've got a bad cold or something that might be the flu, in a lot of countries that just boop, the masks go on. And I think we should be respecting that attitude. Let's see. Here's another one. There have been recommendations for booster shots. Do I need to get them right away, or how should I think about that?
Of course, right now we're vaccinating people with immunocompromised immune systems. And as you mentioned earlier, September 20th, we will begin the third doses with certain groups, those who were vaccinated first, healthcare workers, older people, again, people at certain risks. So it will be sort of a kind of a guide. We'll be following guidance based on the groups as they are presented, and we'll really be just following those guidance, the guidance as it comes.
Okay, and I guess I will ask a question then about the booster shots. I read somewhere that third shot is something that really increases the number of protective antibodies. That the first and the second one, they do something, but that third one is the number I remember is a factor of 10 times more antibodies. A real improvement. Is there what's the best thought about how much more protection you get from a booster shot?
The way that I view it is whether it boosts it 10 times, 5 times, in my mind, it doesn't matter. It's about maintaining that sort of prolonged immune response. That's what we're really after here, I think, more than anything. So for me, I'm viewing it as the boosters, if it's able to just maintain the level that we've had all along, even if it goes higher, great. But at the very least, it's maintaining what you've already got.
Yeah, and one thing that I think many of us have learned is that the immune system is very complicated, and there are different parts of it with different memory lifetimes. And it's more, you can't just count antibodies and know what your immunity is. It's much more complicated than that. And so the effective boosters, I guess there are some sequences of 3 shots where the third shot is almost for life. And so that it may be that we're not in some regime where every 8 months, every one of us is going to have to get, we may be luckier than that. The rate of scientific progress on vaccines is really impressive.
And to go along with that, there are some infectious diseases that in terms of the vaccines that were produced, we're not exactly sure biologically why you do get lifelong immunity from certain vaccines with certain pathogens. We'd be so lucky if that were the case with this one.
Okay, so we're running low on time here. So if any of you just have some final thoughts here on what people should be thinking about as we continue the battle here. Lynnea, do you want to head that off?
Yeah, sure. Thanks. I would like to just kind of recap by saying for people that are deciding whether to get vaccinated, there are lots of resources out there. And I think it's been mentioned earlier tonight about talking with your own primary care doctor, which is a really great suggestion. Talking with health professionals, certainly looking at trusted, reliable sources of information. And again, there are lots of community resources out there to talk through for anyone who'd like to kind of talk through some of their concerns, or if they're more practical, simply how to get to a vaccine clinic or what are the hours. There are lots of community resources out there to help folks with that. And VNA is one, but there are others.
Thank you.
I would like to say two main things. One, we can get out of this. It doesn't have to be like this forever. We are gaining more knowledge every day. We have resources, we have medications, we have excellent public health officials. By far, our best tool is the vaccines. There's no question. If you look at the history of infectious disease, we don't have measles outbreaks, polio, as you mentioned, Dr.
Yeah, I am a doctor back a long time ago.
Dr. Foster, that's right.
That's right. I think I was only called Dr. Foster on the night that we went out drinking after I got my PhD.
That's right. That's right.
But I technically am Dr. Foster.
Kids used to die of ear infections before we had a vaccine against the bacteria. One of the bacteria that's so there are so many. We have so much experience with preventing infectious disease from causing widespread mayhem. And all of that experience is, or points to the fact that vaccines are the way to get these things under control. As the vaccine technology keeps getting better, thanks to people like Dr. Antonopoulos, we keep getting better and better at it, but it only works if people get the vaccine. And the second point that I want to make is just, again, at this point, with this new variant, it's almost like a new pandemic. It's almost like a whole new virus. It's so much more contagious. It causes more severe disease too. And at this point, as I said before, you're almost making a choice between vaccination and getting COVID. And one thing we know for sure is the long-term effects, even the short-term effects of COVID are between 30 and 100 times worse in any side effect you can think of than anything you could get from the vaccine. So it's not just a choice of vaccine or not. It's a choice of vaccine or dealing with the effects of COVID.
Yeah, no, I think that's an important point. You're always, everything we've seen indicates you're better off by far being vaccinated here. Dr. Antonopoulos, any final thoughts?
Probably just going to be echoing what's already been said, but one additional point that I'd make, being a microbiologist myself, and looking through this from the lens of quote unquote raw biology, the virus does not care about county borders, does not care about state borders, does not care about national borders, does not care about international borders. We're all in this together. And it's a phrase that's been said again and again. And I think for many people, they might view it askance as a little bit corny, but from a raw biological standpoint, the virus does not care about these types of borders. And so as a result, if there are pockets of low vaccination rates, they are, just as Dr. Gupta pointed out earlier, they're going to act as reservoirs and they will persist, and you will have an incubator for additional variants over time. The vaccines, without a doubt, are the most effective tool we have at stopping this pandemic. Full stop.
Yep. No, I couldn't agree more. And the only other thing I'd like to say is to transmit our gratitude to the scientists who figured out our best way forward, to the doctors who provide important care, and just to all of the medical first responders and everyone involved, all the essential workers. It is, we couldn't have gotten through this at all without your help day and night. And so I hope, and I think we owe it to you to get ourselves vaccinated so that you don't have to continue the sort of struggles that you're undergoing, just dealing with the load of patients. You read these heartbreaking stories from the southern states now who have not gotten their population vaccinated, and the ICUs are full. And it seems like we're just returning to the nightmare of last winter for no good reason, except that people didn't get vaccinated when it was best for them to do so. So anyway, I just want to thank all of you out there. And for those of you who may be missing this or on YouTube, we will be posting it to Facebook as well. So thank you all. Stay safe. And if you haven't yet, get vaccinated.